today we're going to talk about natural approaches to arthritis. Normally I have a sign-up list if you guys want to know about future events. I apologize I didn't bring it, so if any of you are interested in being on the mailing list, just email me. My information is on top of the handout. Hopefully you'll have a lot of this information on the handout, but I'll point out things that aren't on there in case you want to jot them down. So with that, my name is Dr. Lena Kian, and I'm a naturopathic doctor. Just raise up hands, how many of you have heard of naturopathic doctors? Okay, good, so about half the room. ND is a short form for naturopathic doctor. We're primary care licensed doctors in many states that recognize NDs as primary care doctors. California is one of them. So we cover anything from prenatal to geriatric care in terms of diagnosing health problems at their root cause and looking at natural treatments to be able to address especially chronic health concerns. So today with arthritis, I want to talk about inflammation because any itis is inflammatory related, and we want to talk about chronic versus acute inflammation and kind of anything chronic. We want to go deeper than just get rid of the symptoms, but really what's causing the problem. So with that said, Bastyr is one of the main medical schools that naturopathic doctors graduate from. There are 5 other medical schools in the country. And a lot of our focus is on prevention and looking at the treatment of chronic conditions. Diabetes and heart disease are 2 big ones, and there's actually 2 recordings that we did on that if you guys want to take a look at that. We look at allergies, hormone imbalances, and anything that's stress related, and a lot of the focus is on nutrition. So the talks that I give is really trying to give you the tools. I want you guys to be your own best doctor and to be able to really connect with your body, because ultimately our body has a great ability to heal itself, and I want you to really tune inside and kind of tap into that healing ability. And with any of the health diseases that we talk about, I want the message to be positive and hopeful that if we look at the cause of the health problems, our body heals itself. So today is one of the examples that we'll talk about, but as I mentioned, any health concerns, we want to look at the cause. So we're going to look at the overview of naturopathic medicine today and then talk about what inflammation means from a chronic inflammatory definition, and then looking at arthritis and other autoimmune conditions at their root cause. And the 2 main areas we're going to talk about is food allergies and stress. We'll talk about some common test things to consider, and then in terms of treatments, we're going to look at nutrition, lifestyle, things to do, things not to do, and then some of the common supplements to consider. Looking at naturopathic medicine, so it's basically blending centuries of wisdom with current scientific advances, so we say it's the best of both worlds. And the credentialing, as I mentioned, is ND. You may have heard of terms like holistic medicine or complementary alternative homeopathy. There's so many interchangeable words that can confuse the public, but from a primary care angle, it's ND that you want to look for. These are licensed doctors that have gone to the medical school, and you can see that they're licensed as primary care, similar to MDs and DOs, and they attend the 4-year postgraduate naturopathic medical school. The curriculum is similar to the standard medical curriculum, in addition to training in natural therapeutics such as nutrition, botanical medicine, and other lifestyle therapies. So these are some of the examples. We can use nutritional counseling like whole foods and hypoallergenic diet. I'm going to talk a lot about food sensitivities today. And then we can use vitamins, mineral therapy, what we call medical nutrition, using that for certain healing purposes. And then botanical medicine, homeopathy, hydrotherapy, physical medicine, counseling, lifestyle. These are all examples of therapies that we do as NDs. So looking at the essence of what makes naturopathic medicine unique, the first one is the healing power of nature. As I said, recognizing that your body has a great ability to heal itself. And then this is the biggest one, identify and treat the cause of health problems. Because a lot of times if we just treat the symptoms, once we stop the treatment, the problem comes back. But if we go deeper, we can pretty much eliminate or eradicate it at a deeper angle. First, do no harm, always important. Treat the whole person, mind, body, and spirit. And then doctor as teacher, this is why we're here kind of educating you guys. And then prevention is best cure. So let's get on to the main topic for today. So the reason I bring up the word inflammation is that any word ending with itis, like arthritis, pharyngitis, which is sore throat, colitis, inflammation in the colon, tendinitis, inflammation in the tendons. Any itis is, the root of the problem is inflammation. So if we address inflammation, a lot of times the pain and any other pathological kind of things that follow that will get addressed as well. So first of all, inflammation, if you look at what it is, it's the body's ability to protect itself. So pain and inflammation go hand in hand. Whenever, let's say you have tendinitis or you sprain your ankle, your body, you're hurting, right? And what do? You protect that part of your body, because if you keep running or using it, you're going to injure it some more. So from a short point of view, inflammation is the body's attempt to protect itself. And it could also be a way to remove harmful substances, such as damaged cells, irritant pathogens like bacteria or viruses. In that sense, then it begins the healing process. So, you know, that example was if you have an injury from a fall, the swelling, the redness, the pain is a sign of inflammation. And then from there, the body tries to heal itself if you give it the proper time and healing and the proper treatment. So that's what we call acute inflammation. But when there's too much inflammation over a long period of time, that's what we call chronic, which is the problem. So chronic inflammation is a problem, especially when your immune system is initiated and it just kind of gets triggered in the long run. And these are some of the symptoms that are related to chronic inflammation. So asthma is an inflammatory problem having to do with vasospasms of the bronchi. Autoimmune conditions like rheumatoid arthritis, lupus, MS, colitis. Heart disease is actually an inflammatory process that gets initiated and causes damage to the arteries. And even cancer is recognized as an inflammatory initiation process. So just to kind of differentiate between acute and chronic inflammation, acute is a sudden injury. You can kind of time it together. So you see pain, redness, swelling, heat. It's very time sensitive. You start to see improvements over time. Whereas with chronic inflammation, oftentimes in the beginning, there are no immediate symptoms. And it kind of starts to show up over time as maybe vague symptoms, and then the doctor starts to realize, wait, there's inflammation going on here that's been going on longer than you thought. There's really no initial sudden injury, but just kind of this lingering inflammatory problem. So a lot of times, unfortunately, when we treat inflammation or pain, we just treat the symptom of a problem. We don't necessarily go deeper to the cause. And the way we treat it is with aspirin, which are non-steroidal anti-inflammatory drugs. So aspirin, ibuprofen, naproxen, which is a leaf. And you know, maybe it's okay on the short run, but on the long run, unfortunately, it can damage the kidneys, it can damage the liver, it can actually cause ulcerations in the stomach. So we don't want to rely on these long-term, and especially since they don't treat the root of the problem. Unfortunately, sometimes people even go deeper than that and they rely on steroids. And I think some of us at some point may have had experience with either prednisone or cortisone in terms of topical skin problems. And the problem with steroids is that they actually can suppress the immune system. So, you know, it's a big problem for those especially who are elderly and have risk for osteoporosis as well, because there's a big relationship between steroid use and osteoporosis. Not to mention that when it lowers the immune system, you're more likely to catch colds. So again, I don't recommend using steroids long term. It can also cause cataracts, it can increase the risk for diabetes, it could reactivate herpes because again it's an immune related element. High blood pressure and insomnia, it can be very stimulating, so a lot of people notice that steroid use can cause insomnia. And not to mention their side effects. You know, we mentioned the side effect problem with, you know, all of these, but also, do you guys remember the drug Vioxx? I think in 2004 is when people really woke up and realized that over 60,000 people were killed as a result of side effects from Vioxx due to strokes and heart attacks. So these things come with potential risks. So the bigger question is, let's treat the cause. Let's not just, you know, try to put something, you know, kind of treat it with a pill, but what could be causing it? And a lot of times, chronic inflammation is something that's been lingering on and on, as I mentioned. And A lot of times it's dietary, eating fast foods, oxidized fats, so anything that you cook in high temperature, greasy foods. Sugars are very inflammatory. Any, either just pure sugar or any simple carbohydrates are very inflammatory. Being overweight, so too much body fat actually releases inflammatory cells. So one of the tests that I've recommended, this is on the second page of your handout, which is CRP. CRP is a marker for inflammation, and we see that number being high just from being overweight. So one of the ways to lower CRP if someone has elevated body fat is to actually lose weight. So that by itself could be a risk factor for chronic inflammation. Poor diet, there's certain nutrients that are anti-inflammatory. So lacking those nutrients can trigger inflammation. Diabetes is a type of inflammatory reaction. High insulin levels, sedentary lifestyle, smoking, long-term infections, gum disease, and stress. Those are all things that can either make inflammation worse or it can cause inflammatory reactions. So some examples of autoimmune conditions that are related. So again, look at this itis, right? Rheumatoid arthritis, Hashimoto's thyroiditis, another example. This is a thyroid. A lot of times hypothyroidism has an inflammatory reaction to it. So if any of you have hypothyroid, definitely ask your doctor for a test called TPO. It's thyroid peroxidase antibodies. That way you can find out, well, is my thyroid sluggish because I have antibodies attacking my thyroid? You always want to find the cause of why your thyroid may be sluggish. So if it's inflammatory related, at least you can get to one of the possible causes. So Hashimoto's is just describing the type of hypothyroid that's related to autoimmune. Another one is systemic lupus, multiple sclerosis, celiac, Crohn's, and ulcerative colitis. A lot of these have a relationship to the digestive tract. So one of our greatest mentors, Dr. John Bastier, who the university that I went to, Bastier University, is named after, he would always tell us, when in doubt, treat the hole in the middle, which is our gut. So our gut has a huge relationship to how we feel with regards to systemic parts of our body. So now what I'm going to do is connect why our digestive tract's related to inflammation and autoimmune conditions. So, with that said, I kind of gave you guys a hand, and no peeking because the answer is in this handout. Maybe just, you guys can just raise your hand, and I'll just see whoever raises their hand first. So where do you think most of your immune system is found? Intestines, yeah, in your gut. Thank you, that was quick. So most of your immune system's found in your gut, because sometimes we think, oh, it's just floating around our blood, maybe it's in our tonsils, and there's our appendix. Well, those are some of the examples of where the immune system lies, but the majority of it is in the gut. So now the question is, when we say majority, how much? So let's go by percentage. How many of you think 30% is in the gut? Raise your hand. 40%? 50? 60? Okay, 2 hands. 60? 1 hand? 70? Anyone peek up here? 80? So 90? So most hands said 70. That's correct. 70% of your immune system's in your gut, which is actually huge, right? If you think about it, if that's the case, that's the area we want to address, because your immune system's related to any kind of inflammatory and autoimmune reactions. So let's talk about how that's related. So every time you have a weak immune system, you want to look at the gut and look at, well, why is that a problem? And a big majority of it is that it's called GALT. It's called gut-associated lymphoid tissue. The majority of the tissues is in our intestinal system. These produce and store immune cells that attack infectious agents. Other places could be in your tonsils, your adenoids, your appendix, your large intestine, stomach, and esophagus. So if you look at a picture here, all these blue kind of nodules that you see are where our immune system's residing, and that's where the gut-related lymphoid tissue is, the GALT. So now what I'm going to do is kind of make a connection to why that's important how many of you have heard of the term called leaky gut syndrome? Raise your hand. So we've got about 25% of the room. I think Dr. Oz did a really good job explaining leaky gut, and I'm really grateful because it really makes a difference when we address digestive function, how much of a difference it makes. So I'll explain how that's related. So if you look at someone who has leaky gut, I'm going to explain what that is in a second, but if someone has it, what happens is they're more susceptible to having sensitivities, whether it's to certain foods or to certain chemicals. And when that happens, your body releases histamine. And we think of histamine as allergies, right? We take an antihistamine like Claritin, and our problems, get less because it suppresses histamine release. But when histamine is released, it actually is it triggers inflammation, and it makes pain worse. So if someone's in pain, what do? They pop an aspirin. So when someone takes aspirin, it actually affects the lining of the gut, and it makes their leaky gut worse. And then the leaky gut gets worse, you have more and more food sensitivities, and then you got more histamine, and that vicious cycle continues on and on. So a place to end it is to actually address the leaky gut, because you don't want someone to say, well, just suffer with the pain, don't take aspirin, and it's like, I'm in pain, do something. We want to definitely look at the cost. So I just want to explain what leaky gut is, and then we're going to look at how to address leaky gut. So the normal lining of your intestine, if you look at your intestine, this is your large intestine, the one that, I'm just going to go look at it right here. Right here, this is your large intestine. And then your small intestine is what leads to the large intestine, and that's where the food from your stomach gets dumped into. And that's where the majority of your food is broken down and digested. So when you take a look at the surface area of your small intestine, it's so big that when you flatten it out, it's the size of a tennis court. It's that big. And the reason it's that big is we want to absorb as much of our nutrients, right? Because if all your vitamins, minerals, your proteins, they get absorbed, we want to enhance as much of that surface area to be able to get it to the blood, and then the blood can transfer it to your cells and give you the energy that you need. So it all begins with digestion. So if you take a look at these intestinal cells and you break it down, it's basically what we call the epithelium. These are the lining of your gut, and each cell is tightly bound together. We call these tight junctions. So they're tight enough, you can see they're really, each cell is nicely tightly bound. It's not too tight, but tight enough that it doesn't allow large molecules to get absorbed into the blood. It's going to wait until the molecules are broken down, with digestive enzymes into smaller molecules, and then they're going to enter the bloodstream. Once they enter the bloodstream, then the immune system says, okay, you're good to go. It's like a security gateway. You're good to go. You're a protein, you're a fat, you're a carbohydrate, you're vitamins, minerals. You're on my side. You're going to help me kind of do what I need to do. So it doesn't see it as foreign. That's what I'm trying to say. If there's damage to this lining, there's going to be a problem with this lining. That's what we call leaky gut. It starts to develop holes. So I'm sorry this is blurry, but if you look at the lining suddenly, here's one cell, here's another cell. Now we've got these kind of open pores. That's what we call leaky gut. And suddenly we start to see things leaking into the bloodstream. They could be pathogens like yeast, fungus, toxins. They could be undigested foods. Suddenly these that aren't supposed to be in the bloodstream start to leak into the blood. And the immune system says, wait a minute, you're not supposed to be here. And it starts to attack, right? It's doing its job. It's saying this is not supposed to be here. I'm going to get rid of it, and it clears it. But if this keeps happening over and over and over, the immune system becomes hyperactive. And a lot of people don't notice this happening. They might be tired. Sometimes they have these vague symptoms like they don't feel well, they can't focus, they don't, just like more of that malaise feeling, but there may not be as clear a reaction until it just kind of goes too far. And then the immune system suddenly not only starts to attack the foreign agents, but attacks itself because it's no longer recognizing itself as itself. That's what the term autoimmune means. Auto means self. The immune system is attacking itself as if it's a foreign agent. So part of the reason we want to calm the immune system down is to control this hyperactivity. So prednisone suppresses the immune system. That's kind of the crude way of saying, okay, a lot of these conditions are hyperactivity of the immune system. Well, I'm going to use prednisone to calm it down. That's kind of the short-term approach. But long-term is what caused it to begin with. How can I calm down the immune system so that on the long run it's not being hyperactive? So then the question is, okay, how did it get there to begin with? How do we get leaky gut? By the way, another word for it is intestinal permeability, which is increased. So there's increased permeation into the bloodstream. So just kind of backtracking again, when the intestinal lining becomes damaged, even larger substances pass into the bloodstream, and it causes things like bacteria, undigested food particles, toxins to go into the bloodstream, and that causes an alarm into the immune system. And some people notice fatigue, others have food sensitivities. You know, they might notice as soon as I eat that gluten, I feel horrible, or they suddenly start to notice reactions to foods that used to be okay, but suddenly it's a problem. They might notice gas, bloating. They might get recurrent colds. A lot of people have food allergies, and as soon as I tell them, well, stop, eating certain foods, and they're like, I don't want to, and we kind of get them to comply, and I'm like, well, you used to get colds 5 to 6 times, a year, and now you're getting colds 1 to 2 times a year. Why is that? Immune system's happy, it's nice and calm. So recurrent colds can be a sign that your immune system's not balanced, and it could be food related. Joint pain, because again, it's triggering inflammatory reactions. Skin rashes, a lot of times eczema can be related to food sensitivity. So if people cut back on their food sensitivities, it's not triggering inflammatory eczema-like reactions. Or dermatitis is another word. So remember that itis word again, it's inflammation to do with the skin. And it might also trigger autoimmune, as I mentioned, with rheumatoid arthritis, Hashimoto's, or lupus. So besides food, other causes could be chronic stress. Stress can do wonders on the body, so it could basically just fuel the fire. Chronic inflammation, intestinal infection. Some people say I haven't been well since I traveled someplace and I got a parasite or I got some kind of an infection and it hasn't cleared. Or perhaps it's cleared, but it's triggered an inflammatory reaction in the body. So we want to heal the body's tissues before that goes away. There's something called small intestine bacterial overgrowth. That could be another cause. Environmental contaminants. I think, I'm seeing so many people with food sensitivities, and it's starting to bother me, to be honest, that people are reacting to almonds, to eggs, to dairy, to wheat. Gluten sensitivity is becoming so common, and I don't necessarily think those are bad foods. Why are we suddenly developing allergies when, 1 or 2 or 3 generations ago we used to be able to eat these foods? I think some of it has to do with environmental contaminants, GMO possibly. So I think removing that burden the body has of environmental pollutants is a really big deal. So you could do a lot of good on your end to make sure you use chemicals, products that are free of chemicals, and just reduce your burden of toxins as much as you can. That said, excess alcohol, that's a form of toxin. Poor diet, smoking should be on there. I don't know why I didn't put there, but that's another toxin. Excess medication, that can definitely damage the lining of the gut. Poor immune function and food sensitivities. So I want to mention, if you notice on the last slide, I put the word food sensitivity and not allergy. Yeah, question.
You said smoking it will affect with colitis and stuff like that?
Yes, absolutely. Smoking is a toxin.
That's my wife's problem.
Okay.
She has colitis and now she started smoking.
Smoking, okay. So smoking cessation, that's one of the causes to address, absolutely. So with the word sensitivity, this is the area we want to talk about, is the IgE. IgG. A true allergy is an IgE. A lot of people say I've been tested for food allergies by my doctor and I've been okay. A lot of times people do skin prick. Have you guys had that done, a skin prick, usually on the back or the arm? That's an IgE. They usually insert the allergen under the skin and look for a real reaction, a redness. That's only testing that IgE reaction. It's usually very quick that you get the reaction, no more than 2 or 3 hours, usually within minutes. That's why you stay at your doctor's office and they can read it. It's not going to take hours or days for them to read their response. So those reactions are a lot more intense also. You get hives or anaphylactic responses, swelling in your tongue or throat. They're a lot more acute and a lot more intense. Whereas with the delayed IgG reaction, they're a lot more subtle, they're a lot more chronic. So you might eat the food and then 2 days later get the reaction. So it's very vague that you may not put the two together. It's not like you eat the peanut and within 10 minutes you're like, oh my goodness, I can make the connection. Your reactions may be from 2 days ago if it was IgG related. So a lot of times this gets overlooked from the conventional perspective. And I think more and more people are recognizing that gluten sensitivity is a problem, because a lot of times we thought that it was only celiac. Celiac is an autoimmune reaction to gluten. That's only a small population that have a true reaction that way. There are people who have a gluten sensitivity, a delayed reaction to gluten. They may be able to eat some and not get such a big flare-up like a celiac patient does, but it's still bad enough that it's worth eliminating and seeing if they notice a difference. I'm going to take this question, and then if we can hold off questions till the end, that would be great.
I just wanted to know the allergy and the sensitivity you're speaking of. Like if you can't figure out what you're sensitive to by any of these tests, right?
The skin prick test only picks the IgE, just because of the nature of the test. So now I'm going to describe how to tell how it's done. So we'll talk about that in a second. So let's do that right now. First of all, the way you can tell if you may have food sensitivities is that some of these may be related. So if you have irritable bowel syndrome, heartburn, constipation, diarrhea, gas, bloating, cramping, colitis or Crohn's, big relationship with inflammation and food. Other autoimmune conditions can be food related as well. Now, there may be a cause and effect. I think those who have food sensitivities are more likely to get these inflammatory reactions, but then if you address the food sensitivities, these reactions will go down. So it's possible that once we address the whole person and the lining of the gut, you may be able to get away with certain foods that you used to have a problem with, but to initiate the process. Remember that vicious cycle I showed? We want to address the leaky gut, we want to get rid of the food sensitivities and help the body heal, and then we can see how far we can go with certain food tolerances. So I'm sorry, this is a little blurry, but this is an example of one of the labs that uses that tests for food sensitivities. Now there is an elimination and challenge that I'm going to talk about that you can do on your own, but there is a lab, actually there are a few labs out there that can check you for food sensitivities. Basically what they do is it's a quick finger stick test, and it runs for 96 foods, and you can basically check to see how severe the food reaction is. So basically it goes from 1 to 6, and it can check you from dairy, it can check to certain glutens, grains like rice, quinoa. You check all the nuts like peanuts, almonds, eggs, 96 foods, and it can tell you how severe it is. I especially do this for those who have a lot of pain and inflammation to make sure that their digestion is okay. Another way to test for it, I don't know if this is in the handout, I'll just say it verbally, is what we call the allergy elimination diet. The most common allergens are dairy, gluten, which includes wheat, rye, barley, and spelt, eggs, both egg white and egg yolk, peanuts, maybe other nuts like almonds, corn, citrus, and sometimes even beef and pork. So, and for certain people with rheumatoid arthritis, about 1/3 of the population has a reaction to nightshades. That would be things like eggplants, tomatoes, peppers. So basically what we do is we have people completely, and I emphasize the word completely, eliminate those foods for about 3 weeks, which is kind of that clearance period. You completely wash it out of your body. And if you already feel better, you pretty much know there's something I took out of my diet that made the difference. Then the question is, well, which one? Hopefully it's not everything we took out, because it's sometimes hard to stay on that diet. Now, a lot of times, fortunately, rice, most vegetables, most fruits with the exception of of citrus. Most legumes, with the exception of soy, are okay. Oh, soy is another allergen, potential one that I didn't mention. So you can stay on that hypoallergenic diet for that 3 weeks. And then when it's time to reintroduce, you want to introduce it one every 3 days. Because remember we talked about that delayed reaction, it can have up to 3 days for a reaction. We want to give the body enough time to give you an indication that it's a problem. So you eat the food on one day, you wait for 2 to 3 days, and you pay attention to your body. You can say, well, for 3 weeks I've been off these foods and I noticed my eczema got less, or I have more energy, or my headaches got better. There's a lot of chronic ailments that may be related to food sensitivities. Once you have an idea of what is a good baseline for you, when you add that food back, you pay attention to your diet for 3 days and go, I noticed ever since I've added that food back, my symptoms have come back. Or maybe I didn't even notice that I used to get tired and my fatigue went away after 3 weeks, but now that I've added this food back, it's come back. So it really helps you connect the foods that you've been eating on such a chronic daily basis to the reaction you may be having. So after 3 days, if you're clear that the food wasn't a problem, you can add the next food. And just kind of go from there. If you're pretty sure that food is a problem, get it out of your system, and then just wait till your symptoms are clear, and then add the next food. So that's what we call elimination challenge. We're basically challenging the body against foods that may be a potential problem. So I actually like doing both the test and the elimination challenge with patients because I like them to connect with their body and find out that indeed this is a problem for them. So this is an example of a lab. There are other labs that I would encourage anyone who has any kind of inflammatory condition to do. This is in your handout on the second page. So the CBC is a complete blood count. It measures your red blood cell count and your white cell count. So sometimes when the body has inflammatory reactions, the white cell counts may be elevated, or it might be actually too low from just chronic wear and tear of the immune system. So it's always good to check that. Anyone suspecting rheumatoid arthritis might want to check RF, rheumatoid factor, or ANA is another marker for autoimmunity, so you want to check that. It's always good to get a baseline on the SED rate, which is a marker for acute inflammation. A lot of times I use the SED rate and the highly sensitive CRP. These are both markers for inflammation to assess how well our therapies are working. Obviously, if someone says I'm in less pain, our symptoms are very important to listen to, but we always want to have markers to make sure we're on the right track. So these are good things to kind of guide us. Vitamin D is really good for controlling autoimmunity. So there's a big relationship between vitamin D and the immune system. So I always make sure that the vitamin D levels are accurate, are basically balanced. So 60 is a good range to be at if someone has especially autoimmune disease. In the lab it says from 30 to 100, and a lot of people get missed because if it says 30, the doctor doesn't tell you that it's too low. So optimum is around 60. Another one is a fasting serum insulin. I mentioned this in the diabetes talk. It's not just a measure for diabetes, it's actually a marker for inflammation. So ideal level is less than 10. A lot of people show on between 10 and 20, which according to the lab is normal, but these are pre-diabetics, but they're also those susceptible to inflammation. So if you guys have insulin levels over 10, you want to look at your diet and say, is there anything I'm eating that's pushing my blood sugar to be forcing to release insulin? Again, too much insulin promotes inflammation. Another test to do is a salivary cortisol test. This isn't done through your conventional lab. All of these your doctor, if you ask your doctor to do, they'll do it through a regular blood test. Whereas the saliva test captures cortisol from more of a balanced way. A lot of doctors measure cortisol in the blood and it's normal. I'm not talking about disease here, like Cushing's disease or Addison's. Those cause blood levels of cortisol to be affected. This is more from like a functional, like do you have enough energy? Is your body balanced in the right way? When the body's under stress, cortisol levels get affected. So that's that. Have you guys heard of cortisol? It's the stress hormone, so to say. But there's a certain balance we want with cortisol levels. So let's talk about that because remember how we said stress can cause inflammation? I want to talk about how that's related. So chronic stress, and I mentioned the word chronic because, you know, a lot of us go through stress once, you know, not once, but in our lifetime we go through some sort of stress. There is no such thing as no stress, right? And if anything, stress can be used as a positive stimulus to get us going. You know, the procrastinators say, okay, let's go. They use that as a motivation. As long as you have a way to balance your stress levels, it's kind of like the animal who gets chased by prey, right? Once they escape danger, they go hide and they rest and they recuperate. I'm talking about those who have chronic stress and they just don't know how to balance their stress levels. So when the body's under chronic stress, large amounts of cortisol get released by the adrenal gland. This is the gland that sits right above their kidneys. So your kidneys in your back, right in your back, and this gland sits right above it and releases the hormone cortisol. Now, this is supposed to help you adapt. Okay, it's not a bad thing. It's just bad when the body isn't adapting or adjusting to stress. So you may have also heard of the term adrenaline rush. That comes from the word adrenal. So high levels of cortisol can have a negative effect on the body. And there's actually a way we can measure it, like I said, through saliva. So again, I'm sorry this is blurry, but what I want to illustrate is this graph is showing your cortisol levels, and then this is time. And if you just look at the dotted lines, ignore this zigzag here, just look at this dotted line here, and then look at the top dotted line here. This is a typical, the in between the two is a typical rhythm you want to have. So your highest level of cortisol should be in the morning. That's what gets you out of bed and gets you the energy to start your day. So people who have low cortisol levels at night, in the morning, are the ones that say, I need coffee. Don't talk to me without coffee, because coffee can artificially increase your cortisol levels. So as the day goes by, your cortisol levels start to decline, and it typically starts to flatten out in the middle of the day. So you can see between noon and 4 p.m., it's really sharply declined. And most people, when I ask them when is your worst time of the day, if they say I'm really tired around 3 p.m., well, make sure you're not dehydrated, because that's the most common cause of fatigue. Also make sure you have balanced blood sugar, you eat enough protein, and you're not just, you know, eating high glycemic foods that's making your blood sugar go yo-yo. But besides that, it's actually normal to have a certain level of fatigue in the afternoon. And that's why certain cultures have siestas, and they have tea time, and they have maybe even nap time. It's really important to honor your body's physiology, that if you get tired around that time, take a 10-15 minute break, put your head down, go for a walk, rest, you know, don't go for the candy bar, don't push your system to hyper-perform. The nice thing is once you get past that slump, is the body kind of levels off the rest of the day. It's not like this sharp drop that it has. It just kind of gradually goes lower. Your lowest level should be at night. That's what helps you go to sleep. So if people have high levels of cortisol at night, so this is actually someone we measured. So they give 4 different levels of cortisol. And in this person, they had low levels of cortisol in the morning. So most likely they were the ones that said, don't talk to me without my coffee. And then as the day went by, they're like, okay, I'm feeling better. And if anything, it's shooting up to be too high, higher than what we want. And then it kind of drops. And then at night, they've got the highest level of cortisol relative to what we want. And they say, I'm too wound up, I can't fall asleep. So some of these people, you know, reach for the Ambiens and the Lumestas and the night sleeping pills. That doesn't treat the cause. If the cause is elevated cortisol, by lowering that, we can actually help the person fall asleep naturally. Why do I mention this? So you've heard of the word cortisone, right? Cortisone's the medication. It's actually the synthetic form of cortisol, which is what your body naturally makes. If your body's under stress, it's not able to naturally release the proper amount of cortisol to deal with inflammation. That's why the body needs external sources like steroids, like cortisol. But the problem is if you rely on cortisol in the long run, it's going to suppress your body's natural rhythm of steroids. A lot of people who are taking steroids, I can't measure their cortisol levels because it's just going to show what they're taking. It's not going to show their natural rhythm. So, you know, there's certain people who need short-term steroids. I'm not against that, but if you're finding yourself taking it for months and months and months, you're not addressing the cause of the problem. And if anything, you're making this pattern worse because your adrenals are exhausted in the process. Here's another example. This person's just flat out exhausted. You can see there. This is what we call burnout. So, you know, we definitely want to make sure that doesn't happen. This is the last stage of chronic fatigue. And this is a really good book that I recommend. Robert Sapolsky. I like this cartoon. I think it's stress. So, the reason I like this book is that Dr. Sapolsky is actually a Stanford researcher. He really looks into what happens to your body's physiology when you're under stress. And it takes what I described with cortisol to a whole new level. I'm pretty sure the library carries this book. It's a very famous book. That said, if you guys love documentaries, I highly recommend this documentary. If you YouTube Stress, Portrait of a Killer, I think it's on YouTube for free, I hope so anyway. I think National Geographic aired it many years ago and it's still available. I would highly recommend you guys watch this documentary. It goes over the stress and cortisol picture that I talk about. I'll leave this up a little bit so you guys can jot it down. So then the question is, okay, what is stress? Right? We think of stress as emotional or something that's affecting it's our reaction to things, but we don't think about other things that are stressors. So toxins are a form of stress. Anything that's pushing our body to have to clear it is stressful. Chronic inflammation and pain are a form of stress to the body. High blood sugar is stressful. Psychological stress, poor nutrition, physical stress, trauma and pain, and infections all cause your cortisol to be elevated in the short run, and if it keeps being elevated, there's only so long it can stay up. It's going to start to go down and get that burnout picture that I talked about. So basically, we want to address stress at all these levels, because if we don't, the symptoms of high cortisol are high blood sugar, high blood pressure, insomnia, hypothyroid. People who have poor thyroid function, you want to address their cortisol levels. There's a big relationship between cortisol and low thyroid function. Poor digestion. You know, people say when I'm stressed, I get indigestion. So that's the cortisol picture. Decreased immune function. You know, these are the poor students who cram for a test, and then as soon as the test is over, they crash and they catch a cold. Your immune system gets compromised when you're under stress. And then constipation is affected. Oops, sorry.
That's my fault.
Okay, you catch up later. So what is causing inflammation? Well, from a dietary point of view, you also want to avoid these foods. A lot of times people ask me, what do I eat that's anti-inflammatory? We're going to talk about that, but if you're eating all this good stuff, but you're also polluting your system with toxins, well, first we say remove the obstacles to cure. Let's get rid of these, and then we can load you up with the good stuff. So sugar, soda, high fructose corn syrup, MSG, hydrogenated oils, food sensitivities are it's that saying one man's diet is another man's poison. So for some people, gluten can totally throw them off. So if they have a gluten sensitivity, soy, corn, dairy, nightshades, if that's the case for you, eliminate it. Processed foods, there's certain foods that can stay, on the shelf for maybe 10, 15, 20 years or longer. Something's wrong with that, okay? You get fresh vegetables from the farmer's market and a week later it's bad. So just make sure you buy fresh foods. And then smoking is a form of toxin. So whenever I take someone's good stuff away, they're like, what do I eat? So I always want to address that. So instead of sugar or artificial sweeteners, not a fan of any artificial sweetener whatsoever, you could consider these as a substitute. Stevia is a plant that's actually okay for diabetics. It's about 200 times sweeter than sugar, believe it or not, but it has no effect on insulin. So you could use stevia as a form of sweetener. Xylitol is okay in small amounts. It's actually from a tree, from a birch tree, and it has actually some antimicrobial properties. You might see some xylitol in your chewing gum. It's been shown to prevent dental decay. And then small amounts of raw honey is absolutely fine. If you have wheat sensitivities or gluten in general, you could do rice, quinoa, oats, buckwheat. There's some brands like Rudy's or Food for Life that people use and they find it to be pretty good tasting. If you have dairy sensitivities, you could do rice or coconut milk or almond milk. And I'm also not a big fan of soy milk, to be honest. I think that it's too processed, so you might want to look at either rice or coconut milk. Okay, so let's talk about the good stuff, foods that heal. Who has heard of cabbage juice healing ulcers? Okay, actually more hands. Oh, that's great. It's that powerful. It can heal ulcers. So part of the reason is that cabbage is high in a protein called glutamine. And glutamine is so powerful. I mean, I kind of like the term, it's like glue. It heals leaky gut. It strengthens the lining of the gut, and it can actually prevent the leaky gut syndrome from happening. So it strengthens the digestive tract, it heals ulcers, it helps leaky gut. You could buy glutamine as a supplement, but if you're big into food and you want to have a little bit of cabbage each day, you could either juice cabbage, you can shred it, add it to your salad, or you could just buy fermented cabbage, which is sauerkraut. Other foods that are incredibly anti-inflammatory would be things like kale, spinach, celery, carrots, apples, cucumber, parsley, and cilantro. So hopefully that's a good shopping list. You can definitely add that to your smoothies or to your salads and just try to get as much of it every day as you can. Again, eat as many organics as possible, whole foods as possible. If your food hasn't gone bad in a week, it's probably too processed. So I think the more fresh foods you eat, the better. And then try to get us 6 to 8 servings of vegetables each day. Most of your leafy greens are very anti-inflammatory.
Just a question. Is the purple cabbage just as good, or do you use
Yes, purple cabbage is just as good. Okay, so from another point of view, sugar is very inflammatory. I already mentioned that, but I'm not just talking about pure sugar, like you're getting glucose and you're adding table sugar. Anything that's high in glycemic index is inflammatory. So if you guys want to look at either glycemicindex.com or mendoza.com/GI list, you can get a list of foods that are low glycemic and make the majority of your diet low glycemic. That would be things like most vegetables, with the exception of starchy things like potatoes. Apples and pears and berries are good low glycemic fruits. Bananas can be a little bit high, so that's why they're not on the list. Meat in general is low glycemic, especially fish. Fish is very anti-inflammatory. Too much red meat can be pro-inflammatory. So if you're looking at kind of pain and inflammation, I would focus, if you're not vegetarian, eating mostly fish. And maybe turkey or chicken, and limiting meat as much as possible. On the meat angle, pork is the most inflammatory, so you could eat foods like bison, or at least make sure that it's free range, organic beef. Nuts and seeds are low glycemic, and so are beans. On the high glycemic end, these are things like candy, cookies. Not a fan of fruit juice to begin with, so if you're juicing like oranges, I don't recommend it, because orange juice takes the fiber away. That's why you're able to, drink like a cup of orange juice, but you can't have 4 oranges because the fiber slows you down. So I wouldn't recommend fruit juice to begin with. White potato chips, cereals, most cereals are just pure sugar. Sweetened soda, candies, white bread, very high in glycemic. And then white rice. You're better off eating brown rice or wild rice, or quinoa is actually my favorite. And then on this side you can see the things I talked about: apples, berries, legumes, nuts. Okay, so that said, I think a good nutritional guideline would be what we call the plate model, especially if you're eating out. I hope you guys are cooking your own foods, but sometimes it's hard to avoid eating out, and if you do, just eyeball your plate, what we call the plate model. If you visualize your plate, cut it in half. half of your plate should be from vegetables, whether it's lettuce, kale, spinach, your Swiss chard, your cooked vegetables. So if you get like a pasta dish, you don't want your entire plate to be pasta, because it's like, where's the greens? And then when you look at the other half, divide that by a half. So a quarter of that should be from whole grains. It could be yams, potatoes, peas, squashes, or back to that pasta. You just don't want the whole plate, a quarter of it would be fine. And then the other quarter is going to be some kind of protein. So if you're non-vegetarian, you could have meats. If you're vegetarian, you could do legumes, eggs, cheese, quinoa, that sort of thing. So from that angle, then you're eating a balanced glycemic meal. You're not just eating this huge load of pasta that's going to put your blood sugar high and trigger inflammatory-like response. And like I said, vegetables are very anti-inflammatory, so that we can eyeball your plate and make sure that you're getting the right amount of nutrients. Okay, that said, we also want to talk about water, because 60% of your body is made up of water. And from the arthritis, again, today's topic is about arthritis, so kind of going back to that, water lubricates the joints. So if you're dehydrated, you're more likely to have flare-ups. So make sure that you're hydrated. This is a big reason that you have afternoon fatigue, is that your body's dehydrated. And by the time you're thirsty, you're most likely already dehydrated. So make sure you're on top of it. The right amount of water is minimum a third of your weight in pounds converted to ounces. So if someone weighs 120 pounds, a third of that's 40 ounces of water, and then up to a half. So 40 to 60 ounces of water for a 120-pound person would be the right amount. And if you want to be, like if you're dehydrated, if you exercise, if you sweat a lot, you want to go for maybe half of your weight in ounces. And never rely on soda or fruit sugar as a source of water. I think maybe herbal tea is okay, but I wouldn't rely on the other ones. Okay, let's take a look at foods that are good for joint health. So vitamin C is really great for anti-inflammatory, and vitamin C also helps your collagen synthesis. So if you have problems with tendinitis, you want to look at vitamin C in terms of rebuilding your collagen. B vitamins, especially B5, B6, and B12, are great actually for your adrenals. So they help the stress element. They're also helpful for any metabolic, your cells to produce energy. So, and again, leafy green vegetables are really rich in B vitamins. But if you're under a lot of stress, perhaps a B complex might be something to look at. Especially if you're vegetarian, you might want to get your B12 levels checked to make sure that you're not deficient. I love magnesium. Magnesium is a mineral that is one of the most commonly most people are deficient in magnesium. There are about 300 biochemical pathways that rely on magnesium, so it's quite common that people are lacking it. The most symptoms you might notice of magnesium is tension, whether it's muscle pain, so restless legs. If you have restless legs at night, you might want to look at magnesium supplementation to see if that helps. Constipation is another common one. Again, anything that causes tension, so constipation is basically like cramping of the colon. Any aches and pains like fibromyalgia pains or like tension in the muscles, myalgia, you want to look at supplementing with magnesium. Trace minerals like selenium and zinc are really good, especially selenium for any thyroid-related conditions. You want to take a look at that. I put probiotics in there because remember back to that saying, when in doubt, treat the hole in the middle. A lot of us are low in the friendly gut bacteria. This is why there's so much focus on eating fermented foods, because fermented foods naturally have friendly bacteria in them. But it may not be enough, especially if you've taken a lot of antibiotics in the past, because antibiotics kill both the good and the bad bacteria. So you might want to replace the good bacteria by taking probiotics. The other one that's good for addressing inflammation is essential fatty acids. You can look into things like fish oil, krill oil, flax oil. You could do olive oil, a certain amount of walnuts, coconut, avocados. Those are all good sources of essential fatty acids. And then I put down some herbs like ginseng, rhodiola, ashwagandha, boswellia, and ginger. A lot of these have anti-inflammatory properties, so some of the supplements do take these into consideration, especially rhodiola and ashwagandha really help the body in terms of stress. So, you know, I first recommend people to get their cortisol levels checked and not just blindly supplement. At least talk to a doctor before they self-prescribe, but these are some things to talk to your doctor about. And I would probably talk to either a holistic medical doctor or a naturopathic doctor, or maybe a chiropractor or osteopath that's versed in nutritional supplements. So with that, this is kind of the disclaimer. Just, you know, most supplements are safe and effective, but definitely talk to your doctor because some of them have herb-drug interactions. You know, you want to. It goes back to first do no harm, right? You want to make sure you guys aren't first self-prescribing and, you know, it might do harm. So have someone kind of take a look at herb-drug interactions. And not to mention that not all the supplements in the market are good quality. So you want to have someone who's had experience with the right supplements and the right dosage. And again, quality control. It's getting better actually. The FDA is coming after companies that were deceiving the public. They were not listing some of these preservatives that were in the products. They were labeling the products as the wrong amounts, either too much or too little. And to be honest, I'd rather have them put too little than too much, because if people are overdosing without knowing, that's a big concern. So you want to make sure from a safety perspective that the company has good track records, and also it doesn't have any preservatives like cornstarch, lactose, BHD, sodium benzoate, magnesium citrate, food coloring. I see this a lot in most conventional supplements. So it again goes back to that toxic burden, right? You don't want to give your body what it doesn't need. And then when it comes to herbs, standardization and potency is important. And this is why sometimes you hear like, you know, echinacea doesn't work. Well, how did you use it? And did you use the right form? Did you use the right, you know, type of standardization? So that's just one example. But there's a lot of herbs that, depending on how you use it and how it's standardized, the effectiveness will vary. And I put artificial sweeteners in there as well, just to avoid. Okay, so another really important part when it comes to joint health is exercise. Your joints are, you know, it's really essential to support joint mobility, and that's the whole point of exercise, is to really strengthen and tone the muscles that support the joint. So a lot of times if the muscles are weak, you're gonna put all the pressure on your joints. So that's kind of the whole point of doing anything like Tai Chi, yoga, stretching. You really want to make sure you're not, you know, you're not tight in certain muscles that are pulling on your joints. Immobility a lot of times is what causes joint stiffness because you lose your range of motion. And so from like a general point of view, if you're doing any kind of cardiovascular exercise, make sure you stretch before and after exercise. When it comes to stretching before, I like more the dynamic stretches. You don't want to stretch something that's cold. You know, you want to warm up, and once you warm up, then you can stretch, or you could do like active stretches. And then once you're cooled down, you can actually do static stretches. But you know, have someone walk you through it. Swimming, qigong, and walking, especially for those who have arthritis, are better. You know, if you're starting an exercise program, I would advise starting with those. And then apply ice as needed if you have flare-ups. That would be something you could do on a short-term basis. But on the long-term basis, you know, if you feel pain after exercise, and especially if your pain lasts longer than an hour after exercise, you might be doing something that's kind of damaging. You know, you think you're doing your body good, but if you're getting flare-ups on a long-term basis, you might want to reevaluate the exercise. So either slow down or choose another form of exercise. Hopefully there's plenty to choose from. You know, if running is hard on your joints, you might want to look at swimming or bicycling, or just, you know, see what fits for your body. Over-exercise is also a big problem, so definitely you want to make sure that you sleep and you rest and you give your body the chance to recuperate, so that, you know, it actually comes back and helps you, because it helps your stamina and your fitness. So That said, there are a lot of people who have fibromyalgia pain, and they say, I'm in too much pain and I'm not able to exercise. Interestingly, there are a lot of research studies that say exercise decreases the pain by 75%. So it's just a matter of, doing gradual, slow exercise and building up to it. Because if you just suddenly jump into an exercise and you get flare-ups, well, you're going to be discouraged. So, but if you do it gradually, there are a lot of people who actually exercise to improve their fibromyalgia pain. Okay, so it goes back to, again, treating stress as the root cause. So this is a number that's staggering. 75 to 90% of all medical visits are somewhat related to stress, and I can attest to that. I think I see a lot of stress-related conditions all the time. And 43% of people suffer some kind of an adverse effect due to stress. So the first and most important thing is to recognize what is stressing you. Awareness is always the most important thing. One of my best analogies is if you're stuck in a mud, first you have to acknowledge that you're stuck in it before you can get out of it. So recognition and awareness is really important. Then the question is, what do I do about it? If it's something you can't control, can you balance it out? Can you spend your free time kind of giving your body things that recuperate you and replenish you? And if that's not helpful, perhaps, I've had times where I've had to tell people, well, maybe it's your job, maybe you have to change something, or maybe you're in a toxic environment. We sometimes have to remove ourselves from something that doesn't serve us. So it's always important to recognize what that stressor is. And sometimes it's not even about the stress, it's how we see the stress. So, recognizing our perception to the change, to the stress is important. Some techniques to look at if you want to kind of balance your stress with a non-stress is to look at diaphragmatic breathing. I usually do this exercise, maybe we'll just do it for the fun of it. So put your left hand on your chest, and then put your right hand on your belly. And then what I want you to do is just breathe normally and just pay attention to your breath, okay? And see whether your right hand rises more or your left hand. So I'll just give a minute for that. Just really pay attention to your breath and see which hand rises first or further. And if you guys know the answer to that, just put your hand down so I know who's done. Okay, so our left hand was going to be our chest. So raise your hand if your chest rose more. Okay, so about a quarter of the room. So the rest of you, was it your right hand which was on your belly? Okay.
Equal.
Equal? Okay. That's still better. So when we talk about diaphragmatic breathing, we want our belly to rise more than our chest. The chest breathing is the shallow breathers. So I hope I have a picture here. I don't, darn. Okay, so if you look at your lungs just don't end right here. They go all the way down to, almost to your, not that low, but close to your belly button. So when you do deep diaphragmatic breathing, you're utilizing your entire lungs. And that's what deep breathing is about, is to really oxygenate your entire body. So that's why when they say take a deep breath, you're going to use your entire lung and supply your entire body with oxygen. Because ultimately, energy is about oxygen flow, right? So next time, when we're stressed, we shallow breathe. And if you look at babies, they naturally, you see their belly is kind of rising, and they're just natural diaphragmatic breathers. But when we're under stress, we tense up and we only use our chest. So next time you're under stress, just really pay attention to make sure that you're utilizing your entire lungs. And that's what we call diaphragmatic breathing, is to really use our entire lungs. Meditation is also a great way to kind of bring your attention to the moment. So sometimes we get so stressed that we're taken over by the situation, and we're so lost in the situation we can't even see our way out. So meditation is a great way to bring your attention to the moment and just kind of get a different perception to what's happening. Yoga, I put there, it's both meditative and also great for joint mobility. Nature walks, great way to escape our current, a lot of times we're stuck at home or at the office typing and printing and with electronics, and this is just a great way to connect with who we really are, which is just our natural selves. And then just really utilizing community resources and our support systems. I think when we're in a supportive relationship with our community and with our loved ones, we're less likely to be stressed. So that said, I'll just open the room for question and answer, but before I do, our next talk's going to be in this library on Monday, May 12th, and it's going to be on osteoporosis. I hope most of you can attend, or if you know anyone with osteoporosis, I hope I can present a different angle about bone health than just focusing on calcium. Calcium tends to be the Hollywood of osteoporosis prevention, but I want to present more the nutritional element of osteoporosis beyond just calcium. And I'm also going to talk about how to assess for osteoporosis, and besides medications, because a lot of times people are afraid of taking medications with their side effects, what else can we do to prevent or treat osteoporosis? So that's what the next talk is, and with that, we'll just open on for questions.
I just want to two questions.
Yeah.
What is probiotic? And the second question is that I know you said not to drink fruit juice, which my doctor also said, but is it okay to drink low sugar fruit juice?
Okay, so I'll repeat the question because we're being recorded. So the first question was, what is probiotics?
Right.
So probiotics, your digestive system, believe it or not, has 2 to 3 pounds of friendly bacteria. These are things like lactobacillus, bifidobacterium, and different strains of the 2 that I mentioned. So these are what we call friendly bacteria, and they help to control the bad bacteria. Like yeast is a type of bad bacteria. So if we're low on the good bacteria, the bad bacteria can regrow. So if the body is low in those, we want to make sure we replace that, because they have a lot of functions. One of them is that they produce vitamin K, and vitamin K is important for a lot of things like bone mineral density, for absorption of certain nutrients. The other aspect is, again, like yeast overgrowth. We want to make sure that it doesn't promote overgrowth of certain agents. Your other question about sugar. So fruit sugar, yes, is a problem. Now you're saying low sugar drinks, like
Right.
what?
I mean, there are, you go to the grocery store, you can buy cranberry juice very low on sugar.
Sugar. So a good rule of thumb is when you look at the nutritional information, anything more than 6 grams of sugar per serving is too high, because 1 cube is 4 grams of sugar. So if you're putting like 1.5 cubes of sugar, it's starting to make you alarmed that this is too much. So I find that even cranberry juice, if it has low sugar, it's higher than that 6 gram magic number. You're probably better off with water, or putting some lemons in your water, or adding some peppermints, just something to flavor your water. But I love it when people get used to the taste of water. And I think this is something my grandmother said growing up, and I just so appreciate that. You're healthy when you appreciate the taste for water. So I'm just going to get your taste buds to get used to that.
My questions also have to do with the supplements slide. 3 short questions. One is krill oil. I never heard of that. What is it? Where do you get it? Never heard of it.
Okay.
And 2, I know you said you love magnesium, and my question is, can one overdo it? Along with magnesium, the same question as far as overdoing as with zinc and selenium, can one overdo it? Because I know, for example, with PNC, there's no harm. The body gets rid of them, they're washable. But zinc, magnesium, selenium can really overdone. And the third is, I've read many places, many times, that you should not take calcium and iron together because one blocks the other. I forget which one. That we should separate the 2. Based on that, does that also apply, for example, if I'm taking iron, should I also avoid magnesium or zinc along with iron? Do either of them interfere with the other? Or is it only calcium and iron that
Okay, so let me repeat those questions, unless you haven't heard it. So the first question was, what is krill oil? Krill is a type of fish. It's a very small fish. And the type of fatty acid that's in krill is a lot closer to the membrane of your cells. So every single body of your body is made of cells, right? Cells become tissues, and they become organs, and that's what makes different systems of your body, right? So at the deep level, at the cellular level, you want to address the membrane of the cell. Krill is the closest to what your cell membrane likes. The phospholipid bilayer of your cells is very close to krill. So some people respond better to krill oil than they do just plain fish oil. A lot of times fish oil is made from, anchovies or, I don't know what else.
Sardines.
Sardines, yeah.
Salmon maybe.
Salmon, exactly. So for some people, they need less of krill oil to get the benefits that they do.
I've never seen it. I've never seen it in the
They're over the
supplement
counter.
section.
Yeah, you'll see. You'll probably start noticing it now. So your second question was, I think it was about
Magnesium
magnesium
overdoing it.
overload. So I think the second and third
Selenium
was
too.
just, so this is actually why we talk about supplement. We have a whole class on supplementation because too much of a good thing is still bad, right? The problem with too much magnesium, thankfully the body will tell you, is diarrhea. So if you get loose stools, you know that you've overdone magnesium. That's probably the single best side effect. So it's pretty clear. It's otherwise, the body- Actually, that said, I don't recommend people taking more than, let's say, 500 to 600 milligrams of magnesium. So if you're still doing that, and let's say you're doing it for aches and pains or constipation, you still haven't cured it, there's something else going on. It might be food allergies, or it might be not enough water, fiber, whatever else. With selenium, yes. Actually, selenium, even though it's one of my favorite trace minerals, it's something that up until maybe about 20, 30 years ago was considered a toxin, like it is with mercury. And we didn't even recommend it. And then suddenly we jumped the bandwagon and said, you know what, some amount of selenium is actually good for the thyroid, like iodine. The body needs a certain amount of it for optimum function. That said, with a lot of these supplements, there's what we call the upper limit, UL. So you might want to type, if you're worried about what's the maximum dose that you can harm a person, type upper limit of a certain nutrient. Hopefully, not all of them are listed, but with selenium, you don't want to go more than 200 micrograms. Some say 400, I'm very conservative, so I stick to 200. You asked about zinc. Okay, so zinc is similar. The problem with zinc is that zinc and copper need to be balanced. Too much zinc causes copper deficiency. This was a big issue. A few years ago, I remember seeing a lawsuit with a certain denture cream. And what happened was there were a lot of patients that doctors were reporting as having MS-like symptoms, but they didn't really have MS, and the question was, well, what's going on? And it turned out that they were swallowing their denture cream, and the cream was really high in zinc, and so they were getting copper deficiency. And the symptoms of copper deficiency are very similar to MS. So by supplementing copper, all these symptoms reversed. So that's when we know that too much of everything is bad. Anyone going more than 30 milligrams of zinc needs to supplement with copper, about 1 to 3 milligrams. So again, it's back to make sure someone, like every patient I see, I ask them to bring their supplements because I want to make sure they're not buying a little bit from here, a little bit from there. The next thing I know, they're like overdosing one thing and the other. Same thing with iron. I'm not a big fan of taking iron supplements unless someone's anemic because iron is a toxin. You asked about one more nutrient.
Whether they interfere with each other, they make calcium and iron.
I don't know about any other ones. It's definitely a big deal with people who take thyroid medication, or there's certain medications that aren't as properly absorbed. So we always say, keep your calcium and iron away from thyroid medications at least 4 hours. So I know it most in terms of medications. When it comes to nutrients, I'm not aware of any other ones.
So the only ones that interfere are those two then with each other?
Calcium,
and
iron,
iron.
yeah.
Like magnesium doesn't interfere with calcium or iron.
If anything, you want to take calcium with magnesium.
Or zinc doesn't interfere with either iron or calcium.
No, not that I know of. Yeah.
Thank you.
Yes.
I'm here with my mom, and I've just been diagnosed with fibromyalgia. Where does fibromyalgia, I know it's a autoimmune, but where does it fit in with arthritis? Because I know it's more the nerve side than the joints. Can you explain, like, medically what fibromyalgia is?
What's interesting is, the question is medically, what is fibromyalgia? Up until maybe 10 years ago, it wasn't even recognized
Right.
by conventional medicine. And it came to a point where they were noticing certain points of the body that were common triggers of pain, and they started to diagnose it as, okay, if you have 11 or more of these spots, you have fibromyalgia. So then that diagnosis started. From a naturopathic medicine point of view, we don't want to just label someone with a certain disease. We want to say, well, okay, yes, we want to acknowledge that, yes, this is the symptoms, this is what's going on, but we want to go more than just, it's kind of like depression. What exactly is it? Because one person's experience of depression is different than the others. So we just kind of step away from labels and we say, okay, what triggered the fibromyalgia? And a lot of times there's some kind of a trauma that initiated it, and it tends to kind of lock into the muscles. Fibromyalgia from like a strictly definition is pain in the muscles. And a lot of times our body stores memory. So a lot of times when we look at addressing fibromyalgia, we want to look at the mind-body aspect and kind of see, okay, is there a memory that your body has locked into with pain? That's really what I've found to be helpful, is kind of going deeper than just addressing pain. That said, they're more sensitive in terms of flaring up, so there's certain foods you can address that. So definitely the diet makes a big difference, looking at food allergies.
Yeah, I've been looking at the diet, that's why I'm here, the diet and the stress and the supplements. That's when I don't want to medicate. I've spent most of my life medicating, so I'm branching down a different avenue.
Yeah.
I'm of the age where it's really important to me.
Yeah, and that really makes a difference, and then we can go deeper at the mind-body. Acupuncture is great, homeopathy, just going deeper, right? Yeah.
My question was, are you familiar with nystatin?
Niacin?
Nystatin.
Okay. Nystatin, like for yeast.
Yes. Is that for leaky gut or something else?
That's for addressing yeast. So
Yeast.
yeast could be something that could potentially trigger leaky gut. So
Okay.
it might be good to check for yeast before you treat it with that.
Okay.
Thank you so much for your time today.
Absolutely.
I wanted to ask about if you could speak to any of the connections between arthritis and cracking of knuckles, like that sort of a habit type thing. I don't know if it's a myth or what you would sort of say about that.
Okay, so the question was arthritis linked to cracking of the knuckles, so maybe brought on by that. First, let me differentiate between osteoarthritis and rheumatoid arthritis. So rheumatoid is an autoimmune condition that attacks the joints. I don't think cracking the knuckles is going to trigger autoimmune reactions. It's deeper than that. It has to do with the immune system. So in the potential case that cracking could cause arthritis, it would be osteoarthritis, which is more the wear and tear. Anything that's overused can affect the joints, right? Because your joints are lubricated and there's cartilage that kind of supports the mobility of, basically your bones are bound together by cartilage that kind of helps it move, right? So if you're damaging, that joint by doing the wrong movements, like any kind of, like people who type a lot or people who bend a lot or garden a lot, anything that's overused can affect the lining of that joint. So would cracking of the knuckles do it? Maybe. Have I seen it documented as like, this is the only cause? I don't know. So just think of it as wear and tear. Anything that you overuse could potentially damage the cartilage and cause osteoarthritis. Yeah.
Two questions. One, so we've been using filtered water, and two, your plate, we talk about the fats that one should be eating.
Say the plate
The
part
fats.
Oh, where are the fats? Okay, that's such a good question. I
Other
haven't-
than seasoned nuts, but avocados, like with presumed olive oil.
Sure, yes. Okay, so the first question was, oh my God, what's your first question? I'm sorry.
Should we use filtered water?
Filtered water, okay, great. Your second question was so great, I just forgot the first. So yes, I actually do think that. I question how clean our water is, especially, there's so much issue with fluoride, and I'm convinced that fluoride is a big issue. So, not only for thyroid function, but fluoride is just, it's not a nutrient. So, I think it's important to use a type of, like, reverse osmosis to me is the best way to, get quality water, because it basically adds the minerals back once it filters, but it doesn't have fluoride and, other potential potential toxins. So yes, I would personally hesitate to drink tap water. So your second question, where are the fats? That is such a good question. I'm such a big advocate of great fats. So, you know, it's probably sneaking in under the vegetables, like your avocados count as vegetables. You know, you're most likely in your cooking, like with the cooking of the leafy greens or your beans, you're hopefully using olive oil. So hopefully you're using fats to cook your food, but definitely you want to have good fats. You know, like I said, every single cell of your body is made up of fatty acids or fatty membranes. You want to give your body good fats to be able to lubricate your joints, to be able to give the membrane, you know, proper lining. So, yeah, great question. Yes.
Yeah, I've always been under the understanding that arthritis was genetic.
There is a genetic disposition to certain autoimmune conditions, absolutely. Just like there is a genetic disposition to diabetes or certain cancers or heart disease. There is, when we look at genetics, there's, in functional medicine, we look at, well, can we put our body in a certain environment where our genes are not triggered or expressed? So that's why we look at lifestyle so much, because even if you have a family history, you can use that to empower you to not trigger those potential gene expressions. So I think with anyone who has family history, I'm even more aggressive about, okay, definitely respect that and be more aggressive. Yeah, but there's definitely a link. Yeah.
Okay, a difficult question I have never been able to find on food. When we go to the store and buy tofu, I don't know whether the tofu I got is in raw form and I need to fry it or boil it, or does it come already ready to eat?
Is tofu ready to eat? Wow, I'm gonna say yes, but don't quote me on it. I don't know much about food preparation. I think just from everything I read about tofu, it's so processed. You know, I'm not even sure how much of it is the whole soy anymore. I'm not against edamame, which is the whole soy, or even tempeh. You still see hints of the original, you know, soybean itself, but tofu is very processed. Most of it depends on the label. I think a lot of them say, well, you know, you could, for better taste, you can fry it or cook it or, you know, how so. But I think there are some that say ready to eat. So I'm gonna rely on the food labeling for the answer to that. But just from a nutritional point of view, I'm not sure if tofu is a good form of food.
Thank you.
Sure.
So this question and the other lady's questions brought up questions for me, which is, speaking of soy, are soy nuts also considered as processed, or are they okay?
You know, the problem with soy nuts is a lot of times they roast it. So question is how much of the nutrients there. And it's a board. You know, pick your battles. You know, soy nuts or potato chips. You know.
I see.
Yeah.
As far as the good fats go, what's your take on coconut oil?
Coconut oil is
saturated fat, but
yeah.
is it supposed to be good or bad?
So coconut oil is a medium chain fat, which too much of it can, for some people, perhaps elevate cholesterol. That's a whole other argument. Is cholesterol a problem? Well, it is if someone has high blood pressure, high blood sugar. So that's a huge argument right there. But a little bit of coconut oil is actually great. There's so much evidence that it can prevent Alzheimer's. There's also evidence that it's antifungal. So a lot of people use that for preventing.
What's a little bit?
You know, maybe like a teaspoon or 1 or 2 teaspoons.
In a day?
Yeah.
Can you cook with it?
Oh yeah. If anything, if you're frying your food or using high temperatures, I would prefer use coconut oil than olive oil, because olive oil can't withstand high temperatures. It goes rancid. And you don't want anything that's rancid. This is why you don't want to cook with flax oil, even though it's good for you. It can't withstand any temperature. So
My last question is with the vegetable, with the plate and the servings in a day. I know you have mentioned this several times in your other talks too, 6 to 8 vegetable servings a day. This may sound silly, but
everybody can hear.
With the 6 to 8 vegetable servings a day, is it okay to have the entire thing in one meal, or do you have to spread it throughout the day?
Again, pick your battles. So the question was, do you want to eat all your vegetables in one sitting, get it over with?
Exactly, that's the whole idea.
You know what, if that helps you get it in, go for it.
Well, I mean, is it okay?
Yeah, I mean, you know, there's something to be said about like how much can the body absorb at once. I mean, it gets to such fine lines. It's like, you know, if it helps you eat more, go for it. It goes back to, you know, practicality. So, sure, why not? Yeah.
I have a question. If somebody's on DMARDs and biologics, in terms of the testing, for instance, the food, blood testing or whatever, how, is that an accurate test if you're already on all this stuff? My second question is, if you are on this and then, you know, you try the, whatever, the adjusting the food and all this, but the only way you can really tell if it helps is if you go down on the medication, but if you go down on the medication, it takes so long for it to get back up if you've already gotten into flare from going down. So how do you deal with that? So what do you do something?
I missed the first part of your question. The first question, what kind of testing?
Like the food allergies.
Food sensitivity test?
Food allergies, because there are blood tests, correct, for food
Yes.
sensitivities?
Yeah.
If you're on DMARDs and biologics, does that skew?
If you're on DMARCs, what is DMARCs?
Disease marked by.
Oh, I see. Yes, it does. Yeah.
So you can't get an accurate picture.
Yeah, unfortunately it does. It's something I've talked to the lab about. Unfortunately, it's an immune modulator. Anything that's an immune modulator will skew the test results. If anything, it might show as a false negative because it's suppressing the immune system. It's not going to show as a positive reaction. Yeah, unfortunately, I've come across that. So in that case, that's why I introduced the allergy elimination, because you could still do it yourself, eliminate the foods, and then see if your symptoms improve, and then add it back one at a time. So that's still worthwhile. Your second question about you know, weaning off medication. You know, that's why it's important to see someone and have them guide you through it. There's definitely an art to adjusting people's medication. You want to do it as responsibly, especially if they're drugs that have withdrawals, or you know, the weaning of it is, for some people itself, a difficult thing. So,
No, I mean, when it doesn't put you in a flare.
it can. If you go too quickly, it definitely can. So it's just a matter of getting someone at a stable enough point where they can experiment with weaning off. It can definitely be done. It just, there's an art to it. Any other questions? Yeah.
Yeah, so I have two questions. Which way is better to eat cabbage? It's cooked one or the raw?
The question was, is cooked cabbage better or raw? I think the study with the healing gastric ulcers was with raw, because you were juicing, it was half a cabbage juiced. That said, you know, I would, just because you cook it doesn't mean it's not going to work at all. I mean, maybe it's 30% less effective, but I would still acknowledge that it's good.
Wonderful. Is osteoarthritis completely curable if it's in early stage?
So is osteoarthritis completely curable if it's at its early stage? So yes, possibly. This is where you want to look at nutrients that help rebuild cartilage. For some people, this is why glucosamine sulfate has been really helpful, because it helps the body make what we call glycosaminoglycans, which is the precursor to collagen synthesis. So for some people, it actually can help to preserve joint breakdown. Absolutely. And then the other part is what is causing the wear and tear. You know, people have to stop the activity that's ultimately causing the problem. So you can at least slow it down or stop it from regressing further. Yeah.
Question is related to the same.
Okay, sure.
If you have an osteoarthritis diagnosed with that, if it is due to old age, if you do some weight, it helps.
Yes, absolutely. So, you know, again, back to wear and tear, right? If there's force on the joint, It's
You have to
gonna,
exercise, but if you exercise, you get pain.
yeah, that's that kind of vicious cycle. It's like, I want to exercise to lose weight, but I have joint pain. Well, your diet has a lot to do with weight loss. So we can basically gradually build someone, swimming is a great form of exercise. It's not too much pressure on the joints. So we can actually get them going on some form of exercise, and then, diet. I would say probably 80% of weight loss has to do with diet, and then the other 20% is exercise, but exercise has so many other benefits that I don't want it to think, oh, it's only 20, forget it. There's so many other benefits. So at least with the weight loss, it could put less pressure on the joints, and then you can start doing other exercise like walking or, bicycling. Elliptical's better than running or walking because it kind of cushions, you're not like stepping on the ground and you're not pounding. So it's kind of like bicycling. It's not as hard on the joints, but for some people who have knee problems, it might not be as great. So I would listen to your body on that. Yeah.
Do you recommend that food allergy test needs to go through the food allergy test?
Do I recommend it? I actually do. I recommend most of my patients to do it because a lot of times you may not even know you have food allergies, and when you discover it and you eliminate the food and then add it back, suddenly your body starts to communicate with you. Because sometimes you might have it and your body figures out a way to get used to it. And a lot of people are so used to a certain level of energy that when they eliminate the foods, they're like, I had no idea how much better I could be, and that's why we talk about optimal wellness, because some people say, well, I feel good, but can you feel better? So there's certain people who fit that category, that as soon as they get rid of the food, they're like, you know what, that was worth it. So yeah, I like everyone doing it, yeah.
There's some sweet aloe vera juice helping arthritis. What are your thoughts?
So the question was aloe vera juice helping arthritis. So I would revisit the gut picture. Aloe vera is fantastic for gut health. So aloe vera, again, have you ever got a cut and put aloe vera in your hand? See how quickly it heals? It's exactly how it is with your gut. So it goes back to, again, optimizing gut function, healing the gut. It's going to keep your immune system nice and calm, and then it reduces the flare-ups, and as a result, the inflammatory pain goes away.
Daily.
You could do 4 to 6 ounces a day. Yeah, that'd be fine.
And how long can you keep that in your fridge?
Aloe vera juice?
Yeah,
There should be dates on them. I mean, the fresher the better. Like I like to get enough that maybe it lasts you like 2 to 4 weeks, something like that, and you could just keep getting more and more. I mean, there should be expiration dates. I'm just a big fan of the fresher the better. So, yeah.
Also, I want to gain some weight. I have a very hard time gaining. I've been losing it through my migraine headaches and attacks. I don't feel like eating. So I want to regain it, but it's very difficult.
Okay.
Just 5-6 pounds would be sufficient.
Okay.
I'm not asking for. But it's very hard. Every time I'm trying, it's like, that's my limit. I can't.
Okay. Well, thanks for sharing that, because if you just said, I want to gain weight, but you openly shared with everybody what the cause is, because it's not, when someone comes in with a certain complaint, I want to know, well, what's going on for them, because one person can't gain weight for a different reason. So yours is related to migraines and the fact that it's affecting your appetite. So we want to go to, well, let's address migraines. If you don't get migraines, then your digestion gets better. A lot of times migraines are related to, it is an inflammatory condition. So we want to look at food allergies as well, food sensitivities. There might be certain foods for you that's triggering your migraines. So I would look at that. And then on another level, there may be, again, leaky gut. What's interesting with glutamine is a lot of athletes take glutamine to maintain muscle mass or to even gain muscle mass, because glutamine helps to optimize your gut function. As a result, you absorb your nutrients and it helps to maintain muscle mass. We also give glutamine to cancer patients because their appetite is low, they lose a lot of weight, so it helps to preserve weight. So you might want to look at glutamine, because if you have food sensitivities and you might have leaky gut, you can actually start to tackle it from both angles.
Do you recommend adding bread?
Of glutamine, perhaps jarro, that's a good one. I'm sure there are other good ones out there, but I would have to look at it. Yeah. Any other questions? Okay, we'll say last question, we'll call it.
Do you have the presentation available for either online at the library or you can send to us?
Yes, I have a wonderful, dearest friend and colleague here, Judy. Actually, Judy, do you want to?
Okay. I'm videotaping this and it will go up on her YouTube channel.
YouTube?
It's, you can search for Harmony Healing Naturopathic. That's the name of the channel.
Thank you.
Yeah, and I really want to thank Judy because she's also recorded the diabetes and heart disease talk, which, you know, in case I don't get a chance to do these talks, I really appreciate that the information is available. And you're welcome to contact her. She does a lot of great family legacy videos and, you know, any other collections of precious information you'd like her to do for you. So thank you, Judy. So if you have any other questions, feel free to email me. Just out of respect for time, I'll just call it. Thank you so much for coming.